to Mindvine, a mental health podcast for everyone. Since our first episode in 2016, we have been sharing stories of recovery, engaging with experts, and tackling the stigma associated with mental illness. The Mindvine podcast is produced by Ontario Shores Centre for Mental Health Sciences and is available on YouTube, Spotify, and Apple Podcasts.
Welcome to the Mindvine podcast. My name is Darryl Mathers, and today we are talking occupational therapy. It's Occupational Therapy Awareness Month, and occupational therapy is a big part of what we do at Ontario Shores. And we have two special guests today to talk a little bit more about that. So first, before we get started, I'd like to welcome Claudia McDonell and Volker Brandt. Thank you both for being here.
Thank you for having me.
As I was saying before we started filming, that occupational therapy is maybe one of those professions, or certainly in the mental health space, that maybe is a little misunderstood. People don't maybe have a firm grasp of what it means to be an occupational therapist. And as two occupational therapists, I thought maybe we could start by just maybe explaining the definition and what it means in terms of the work that you both do every day at Ontario Shores.
Yeah, for sure.
Go first.
Okay. Well, occupational therapy, first of all, is such a broad field. Mental health is just one area that OTs can get into. We can get into physical rehab, schools, like so many different things. So mental health is just one aspect. OT is a very holistic profession. And in mental health specifically, I think it really focuses on the psychosocial lens that OT utilizes in the holistic approach. So really thinking about how someone's mood, thoughts, feelings, emotions are impacting their ability to engage in their daily life. And at the core of it, when you think of occupation, oftentimes people think occupation means your job. But in OT, occupation really refers to anything that you do that I like to say, occupies your time, or another way to think of it is anything that you want to do, need to do, have to do. So, for example, your job is an occupation, but so is, taking care of your kids or going to the grocery store or sleeping. All these things are occupations. So we really, in our role in mental health, really work with our clients to talk about how their mental health is really impacting those areas of their daily life.
Yeah. I find myself sometimes wanting to simplify the definition.
Yeah.
Sometimes definitions can be quite lengthy too.
Yeah.
And I found certain people might find it easy to understand that it's a bit of a jack of all trade, at least from the inpatient perspective.
Yeah.
And perhaps also, maybe there's a modern role of OT, and perhaps also a certain traditional way that perhaps sort of feeds into it. And so from this perspective, things like talking about anxiety management, talking about mobility, talking about behavior plans, behavior activation, grocery shopping, sleep, food intake, those kind of areas. And as you extend the list, you could always say jack of all trades.
That's true.
As we get into maybe your specific roles at Ontario Shores, we have a variety of programs. Ontario Shores will treat adolescents, adults, geriatric population, forensic mental health. For you two in particular, Claudia, you're on the outpatient side, and Volker, you're inpatient. So I wonder if you could kind of describe, maybe a little bit about your roles, but also the difference between the two, so people may have a better idea.
Do you want to go first?
Yeah, sure. I'll kind of speak to my role and then you can think of some
Sure.
differences. So I work for the First Responder Mental Health Specialty Program. It's an outpatient clinic. It's in association with Trillium Health Partners and WSIB. So our program, we see workers who are referred to us that are first responders. And in our program, we really focus on people that are living with PTSD and other anxiety disorders. And we are a really specialized program for first responders, and our outpatient program that we offer, it includes psychotherapy, return to work sessions, reactivation sessions that are really about daily functioning and how you're doing in your day-to-day, and psychoeducation. So it's kind of this bundle of all these different aspects of programming that we offer. And right now we're offering it in person and virtual. So it's a little bit of a mix. But yeah, we typically have a certain number of clients in our program that we see on a weekly basis. And then we're also doing assessments for new referrals. And sometimes we refer workers to our program and sometimes we refer them elsewhere. So that's kind of our typical week that we get up to in our program.
And how would that differ from your role at the hospital on an inpatient working with?
So first and foremost, I don't have a opportunity per se to do virtual because everything that we do on the inpatient unit as OTs will require to be in-person, hands-on. And things like mobility, for example, or things that relate to ADL, self-care, showering, dressing, those kind of things. So that's perhaps one of those bigger differences. So, I suppose if we have areas like, for example, psychosocial education programs where information is provided to a group of people, it might be a possibility, but being on the unit means that we provide it in person to all of the patients that we have. So that's perhaps one of the big differences. Everything is hands-on in person.
So you mentioned psychotherapy a couple times, and it's also a term and a job title for people in Ontario Shores, psychotherapists. So how does psychotherapy and OT, how does that relationship kind of work?
Yeah, so psychotherapy in relation to OT is a controlled act, so meaning not all occupational therapists do psychotherapy, but occupational therapists can do psychotherapy if they're following the certain standards that we have in place. So that includes things like making sure you're doing the necessary trainings, making sure you have adequate supervision. And it's a really unique aspect of OT actually because like you said, psychotherapists, of course, do psychotherapy, so do psychiatrists, psychologists, social workers, nurses. OTs are actually another one of those professions that can do psychotherapy as outlined by our regulatory college. And it's a really unique aspect of OT. And it's definitely a very valuable role that we can do in the programs. For example, in my program, I'm a clinician in my program. And the other people that I work with, we're all doing similar things. We come from different backgrounds. There's social workers, other OTs, and we can all do psychotherapy. So it's really interesting to kind of relate on that one field. So
we were talking earlier about just the length of time that you guys have been with the organization and the profession. And Claudia, you're relatively new to Ontario Shores, whereas Volker, you're coming on your 14th year here.
Oh my God.
And so you would have been here, as we're coming out of this pandemic, and hopefully on to brighter days. You were here on March 2020 when things drastically changed, for the world, but certainly in our Ontario Shores community and for inpatients. And I wonder if you could talk a little bit about what that experience was like. Obviously from a professional perspective, like how it changed. What you did and how you interacted with patients and how you overcame some challenges, but also, on a personal level.
Yeah. So having said earlier that quite a lot of work that I do and the other OTs on inpatient units will be hands-on, it certainly put quite a lot of brakes on a lot of things that would have been perhaps also going off unit, for example, or the issue and the limitations about physical distancing, mask wearing, and so on and so forth. So there were definitely quite a lot of barriers at first that had to be overcome. And I'm sure we all look back and found that we found creative solutions and within policies and areas. On a personal level, I found it initially very difficult to also explain to patients why we have all of those limitations in place at first. And perhaps it was just like any other education. It took a little while until it was settled and patients got too used to it. And it seemed to be a routine in many respects. And yeah, we all found that sometimes we had to complain. We felt we needed to complain, patients, and so. But we found solutions, and really the fact that we had to make it work was important. And we looked at our mood, our thoughts, our activities, again, our routines, and we found ways to make it work. So.
Just jumping back to maybe your role for a bit, you mentioned that you're part of the First Responders Clinic on Ontario Shores, working with Trillium and WSIB. PTSD is a big term we hear a lot more frequently just in society. It's something that we often associate with first responders. What's like working in with that population? Is it more prevalent? Like, are we seeing more people come through the door? What's the experience like working with something that's kind of inching towards the forefront of people's minds in terms of the risks associated with those types of jobs?
Yeah, so it's been really interesting for me. When I started in the role about a year ago, that's kind of the same time that the clinic started. So it was my first kind of OT role out of school in a new clinic. And I think clinics like this, specialty clinics for PTSD for first responders, they're not brand new, but the prevalence of the amount of specialty clinics out there for first responders is definitely newer. So it's been really interesting, and we've heard a lot of feedback from first responders and the workers in our program that having a program where they are with other people that have experienced similar things to them brings a really unique, valuable element to the program. Just that having that aspect of peer support, I think, is really invaluable because, of course, even as a clinician, we can be empathetic, but at the end of the day, being a first responder is such a unique experience. So I think it's really valuable to have these programs where there's that peer support. And yeah, I hope it will only continue to grow, this program and other programs across the country.
When, prior to the March of 2020, our capacity for virtual care was fairly minimal. We did see clients virtually, but it wasn't anywhere near what it is today. And, from the perspective of the First Responders Clinic, that ability to reach people in their homes, at their convenience, wherever they are, whether it's, during a lunch break at work or whatever the case may be, how has that flexibility, has that improved, the therapeutic relationship? Has it helped? What's the experience been like going, or I guess you've only known virtual, but do you get feedback from patients about the use of virtual resources for that program?
Yeah, so I think like anything, it has its pros and cons, and we do a mix of virtual and in-person. I would say for myself, primarily definitely do the majority of my sessions virtually. I think the biggest benefit is that we've been able to reach workers all across the province. So we have workers from up north to the east, out to Ottawa, to the west. So it's just such a broad catchment area that we're able to serve because, of course, if workers were having to come solely in person, it would be a little bit more challenging if you were living 10 hours away, right? So that's definitely a big benefit. And as well, yeah, I think the flexibility of just being able to kind of attend your session from your home can be really great, especially, workers, in our program, they're often off work or near returning to work. So they're balancing life demands, family demands. So having the opportunity to just kind of do their session from home can be beneficial. Of course, there's also challenges, right? Is that when you're at home, it can be challenging to find a private space or find the best internet connection. So there can be some challenges there. And then in-person also has its benefits as well. I know workers have given us feedback that it can be really helpful to have something on your schedule that you're getting up for, that you're getting ready for, that you're going in for. And that really relates to OT in terms of what we were talking about at the beginning, just kind of how you're engaging in your daily routine. So pros and cons, but definitely it's been able to allow us to reach so many workers that I don't think we would have otherwise.
It's nice to have that flexibility and opportunities and for our patients. In your time, obviously, same profession as Claudia, but different roles in terms of the patients that you're caring for. But when you think about your time, Volker, in the occupational therapy space, have you noticed a significant amount of change? What have you liked about where things are going? What's that process been like in your career?
Change in respect to, well, that now it's virtual services are available, and I know that even patients who come onto the inpatient unit sometimes will have virtual services provided from the outside, so FaceTime or OTN, those kind of things. In respect to patients overall, well, sometimes people might say that the seasons change, and so does the patients too, right? But it seems to be so more or less a pattern over the years. And I have to say that despite the fact that perhaps sometimes patients might come in with more severe symptoms, perhaps more challenges, more complex, it's actually more enjoyable then. I have to say, I don't know, I may be the only one, perhaps sometimes they are a bit more of a challenge, but that's one of those things. If it were perhaps the same old, then you get used to it perhaps. You maybe find it less of an interesting thing. So change in this case is good, and I like it.
We often talk as patients and families come into care out on Ontario Shores, the importance of caregivers and family members taking care of themselves and making sure that while they're supporting a loved one with mental illness, that they manage their own mental health. And we say the same thing about our employees who are taking on a lot of these issues and dealing with some really complex situations. Same would be true for OTs. So what advice do you have? Like, what would you like to see your colleagues do when it comes to caring for themselves?
Yeah, it's definitely a big thing that I think we as clinicians and as people that get into healthcare, I think we can often neglect is caring for ourselves, because I think at the end of the day, we all get into this field because, I think we're empathetic people and we want to help people. But at the end of the day, the more you help yourself, the more you can help other people. I like to think of the analogy of if you're on the airplane, they always say, when the oxygen mask comes down, make sure you put yours on first before you help anyone else. So kind of similar thing. And I think for myself, being a new OT in the field, what's been really, really helpful for me is just having really supportive colleagues and having the opportunity to just talk about how I'm feeling openly with colleagues. I think oftentimes we can have really heavy days or hear stories that might impact us emotionally. So it's really important, I think, to first, find people that you trust, that you feel you can speak openly to at work, to have those opportunities to debrief and ensure that that's a priority in your clinic. And I think that's a really big thing. Anything?
Support. Yeah, I think also definitely having people on a team where you can be sometimes frank too, where you really can speak your mind and also let go, vent in some way too.
Yeah.
So also receiving, obviously.
Yes.
So,
yeah.
But what I found over the years also that really impacted me is actually making use of any of those skills that we are teaching the patients.
Yes.
CBT skills, acceptance, distress tolerance.
Practice what you preach.
Yeah, that's right.
Yes, yeah.
As we continue to recognize OT Awareness Month, where would you suggest people go to learn more? What would you like people to take away from? Is there any maybe parting thoughts about this month and what you'd like to see people kind of take away from it?
Yeah, so I think for myself, one big thing that I really took away from, my OT schooling and just my understanding of the OT profession is how important it is, this concept of occupational balance. So meaning that we do so many different things in our life, and the more you can have a balance of different things that you enjoy, so things that you might do for productivity, like going to work, things that you do because you just enjoy doing them, like working out or cooking. The more you have that balance, the more likely you are to feel fulfilled and just have something to turn to that you value and that you enjoy. And I think that kind of relates back to what we were talking about before, where I think it's really important as well for us as employees and clinicians and everyone at Ontario Shores to have things outside of work that we enjoy as well, because I think it's really important to have that balance, and we don't want to set ourselves up for a situation where we don't have anything that we can turn to kind of give us a little bit of enjoyment outside of work. So I think that's really important to remember this month. In terms of where to learn more, our different professional bodies have lots of great resources about OT in general. So there's CAOT, the Canadian Association of Occupational Therapists, and there's also OSOT, the Ontario Society of Occupational Therapists. Those websites all have really great resources about what it's like to be an OT across many different fields. But
yeah. I was thinking about how I would say it, perhaps keep up the hope and have fun.
Yeah, that's more to the point. I like that.
I know sometimes, I think about our patients too, that, maybe sometimes their attention span is a little bit shorter. So kind of, or maybe they have other priorities, and sometimes, how to explain things, then you keep it short. And so, but I think that covers a lot of things. So OSAT, COTO is our regulatory body, COT for getting to know things a bit more. So, yeah.
Well, thank you both for being here today and helping us learn a little bit more about OT and what you do and how we can learn more. Thank you.
Thanks so much for having me.